Melissa Sheburn from the Frisco Town Council, Karen Kaminsky from the Dillon Town Council, Dick Carlton from the Breck Town Council, Josh Blanchard from the one of our Summit County Commissioners. I think Dan Gibbs is also here. Did Dan come? He was thinking of coming, former commissioner. We're Helen Rayot, CEO of the Summit Community Healthcare Clinic, Scott Vargo, Peak Health, Tamara McKelland, Advisory Board for FERC, Tara Dew, the Summit Foundation, Project Manager, David Ross, Peak Health, Alec Richmond, FERC, Maria Saralos, FERC, Kim Harden, PIO, and Shay Loomis, FERC. So we're joined by a lot of folks, but it's because we have some good news. We knew that, when I took office, we acted with urgency to address the high cost of health care. We were thrilled to work with Representative McCluskey to pass the bipartisan reinsurance program. I was proud to sign the bill right here at the Family and Intercultural Resource Center in Silverthorne. Some of you might remember that day. We knew that program would save people money. This is for people who don't get their health care from their job, right? Some people get it through their job. We're doing a lot of work around that as well. It's less directly impacted by our policies, but for instance, some of our prescription drug reforms will hopefully provide downward pressure on the employer rates. But for people who don't get it through their job, who are self-employed, a lot of small stores, retailers, folks who don't have that as a normal benefit of employment, they get their insurance through the exchange, through reinsurance, small group, individual. The reinsurance program saves people money, and we're excited to announce those savings for this year over what the cost of insurance would be without the reinsurance program. So we'll announce it here. Is it on this one here? Is this the one? Okay, here we go. This is for Summit County in the High Country, 36.5%. 36.5%. Thank you to Representative McCluskey and Representative Roberts and Representative Rich. 36.5% here in Summit County, much of the Western Slope, 36% in Grand Junction. Let's turn around the other one there, if you don't mind, Julie. This is statewide. The average is 24.1% savings, and this shows the different regions, 31.1% in Pueblo, 25.5% in Fort Collins, making healthcare more affordable. This is for folks that make too much for Medicaid, they don't get it from their employer, and they buy it on their own. Often you don't have to pay the entire cost on your own. There's often subsidies, but for some they're paying either part of the cost or most of the cost, and some all of the cost. But to have that cost go down is a really big deal. I also have some other very good news about the impact of reinsurance, along with some of our other reforms. When I took office, there were 22 counties in Colorado that only had one choice for healthcare. And when it's one, it's not called a choice. It's one. That decreased to 10 counties last year. And I'm proud to say that this year, the number of counties with only one choice is one county, Jackson County. That's the only county in the entire state that has no choice in healthcare on the exchange. And Jackson County, we're going to bring choice to you soon. That's our goal. Colorado Option, Dylan Roberts worked on that. We're going to get that done. But it really shows the impact of reinsurance, not just on saving people money, but in shoring up the exchange and improving choice in the 20 counties in our state that didn't have any choice. And now that's down to just one county, and we are so excited. Open enrollment begins November 1st. It runs until at least January 15th. That's a normally scheduled date. It opened several times last year under the extraordinary circumstances. And I think this year we've all realized more than ever how important healthcare is, right? Not to have to worry about going bankrupt if you get the flu, if you get COVID, if you get cancer. That's an important peace of mind that every Colorado family deserves, every Summit County family deserves. This doesn't get us all the way there, but it provides a lot of relief to a lot of people who can afford health care because of the bipartisan reinsurance package led by Representative McCluskey. With that, we're joined by our Lieutenant Governor, the head of the Office of Saving People Money on Health Care, Dianne Primavera.
Well, thank you, Governor, and good afternoon, everybody. I'm thrilled to be here to celebrate one more year of healthcare savings for Coloradoans. I'd like to begin by thanking the Family and Intercultural Resource Center, for hosting us today. This location is significant, not only because of the amazing work that FERC does to support families and strengthen communities in Summit County, but also because, as the governor said, he signed the bill establishing the reinsurance program here in 2019 in a packed room in here. So reinsurance has proven to be an incredibly powerful tool in helping people save money on health care, and our administration is committed to tackling health care reform from every angle, and the success of the reinsurance program is an important part of our work to ensure that easy access to high quality, affordable, equitable care can be a reality for every Coloradoan. In 2022, as the governor said, Coloradoans will save an average of 24.1% on their premiums, and that number is even higher for communities that in our high country like Summit County and on the western slope, with these savings being up to 36.5%, as the poster says. We know that for too long, families and small businesses in Summit County have had very little choice when buying their health insurance, with the plans available to them coming at a much higher cost than for their neighbors along the Front Range. Over the last 2 years, the reinsurance program has helped to reduce that disparity, delivering real savings to people who need it the most. We've had the opportunity during the last few weeks to make some exciting announcements about our healthcare reform efforts, including approval of our updated benchmark healthcare plan, in celebrating the progress that we've made, and in discussing our future plans to make easy access to high quality and affordable healthcare, and also equitable healthcare. We want to make that a reality for all Coloradoans. So it can be easy for us to get lost in the weeds of all these policies and all these language, but the programs actually translate into meaningful savings for our neighbors all around the state. Lower premiums mean more savings going into college and retirement funds, and more money to spend on things in life that matter the most, as we all work to power Colorado's comeback from the darkest days of the COVID-19 pandemic. Governor Polis and I have spoken at length in the past about the difficult stories, the gut-wrenching stories that we've heard in our travels around the state from people struggling to afford their health care and the consequences that they've faced when they couldn't afford the care that they needed. So we will continue to listen to Coloradoans. There's always more work to be done, and we're ready to tackle that. But it's just as important that we hear stories about what's working well in our state and about the organizations making the biggest impact for the communities that they serve, so that we can continue to bolster the work that we've done. So with that, I would like to turn it over to Representative McCluskey.
Oh, good afternoon, everyone. How lovely it is to be here with all of you. The weather is perfect. Thank you, Governor. Thank you, Lieutenant Governor, for your incredible support of reinsurance and in bringing healthcare costs down along the western slope and across the state. You know, as I look out at this audience and think of the journey that we all began years ago when we started screaming about the healthcare costs here in Summit County, I am so proud that reinsurance is one piece of that remedy, one part of the solution in making healthcare more affordable for families. And I will tell you that when we drafted the bill and said we needed a 30% reduction on the western slope, very few of us thought we would actually get there. That was our big, hairy goal, right, Governor? And to see 36.5% today is so meaningful and so important. But our fight goes on. We have more work to do to make sure that our small businesses can provide affordable health care for employees, and that we continue to have access, reduce the health disparities on our communities of color and on those that are unable to pay, whether it be because they don't have access to insurance or they don't have access to quality care in the communities where they live. I am proud to be a part of a legislature that is continuing that fight. We passed a bill last year around prescription drug affordability. We are making progress in bringing down prescription prices. We have been working hard to ensure that hospitals are held accountable and are more transparent in the costs they are charging, ultimately, all of us as consumers. But probably the biggest bill that we passed last year was led by my colleague, my partner, and I hope someone I have the opportunity to work with for many years ahead in the legislature, because he's one of the brightest stars on the horizon. Representative Roberts carried the Colorado option. You're going to be seeing more about the option in the years to come, but I promise you, As your representative down at the state capitol, the two of us will continue that fight to make sure that every Coloradan, every one of our neighbors, every one of our friends has access to affordable health care. So thank you for being a part of the team that made this all happen. You all deserve a big pat on the back. And with that, I will turn it over to Representative Roberts.
Well, thank you, Representative McCluskey. Truly my favorite and best partner down at the Capitol, and it is great to be here in her Summit County and to be with all of you to celebrate this accomplishment. She worked so tirelessly on reinsurance. I remember we sat next to each other that year, and it was a battle to get this bill passed. It really was. There were a lot of people who said no, and the bill looked like it wouldn't move forward at several points. But I'm so glad that it got done because I represent Eagle County and Routt County, which have a lot in common with Summit County. And one of the things we unfortunately have in common is the high cost of health insurance for all of our families and individuals. But the reinsurance program is having real results for real people, because I think when we run for office, including the governor and the lieutenant governor and Representative McCluskey and I, we hear from families and individuals who really want to live here. They want to make their lives here, raise their families here, but they simply cannot, and health insurance is the #1 reason why. And we're helping those families today with this announcement. Hundreds and thousands of more Coloradans in the high country, all across the Western Slope and all across our state, are going to be able to access the security and good fortune of health insurance because of the reinsurance program and the new announcement today. So that is incredibly exciting. This is one of the most exciting things I get to be a part of as a legislator, is helping families and individuals purchase the security of affordable and quality health insurance. And that is something to celebrate in a very big way today. So I could not be more proud to be here. Thank you, Governor, for your team's work to make the reinsurance program successful, and it is just amazing to see it take off from where it started. So thank you all for being here. As Rep. McCluskey said, there is a lot more work to be done. We want to get all of our counties to multiple choices, and we will continue our work to make sure that everybody has access to affordable and quality health insurance. Thank you.
And we're excited. You know, Representative Roberts led the way on the Colorado option. That promises an additional 15% savings. That would be additive to whatever reinsurance can provide at that time. And that is both small group market, individual market. There's mechanisms where if that's not reached, there's aspects of the Colorado option that get implemented. So we're very confident that we can achieve those goals. We're now joined by Nisa Erickson with FERC.
Thank you so much. Get that in the right spot, and hopefully you can hear me. I am Nisa Erickson, and I'm the Development Director at the Family and Intercultural Resource Center. As I look out, I see so many familiar faces in this crowd that really helped with this whole effort for Summit County and made this state possible. So thank you to all of you that are here. Thank you for your efforts throughout the years. It just means so much to our Summit County community and families. At FERC, we know that the high cost of living in Summit County makes raising a family here really difficult. FERC empowers people through education and support to manage some of the challenges of housing, parenting, mental health, and healthcare so that our families can thrive. A critical component of that work is our work on healthcare. We have folks here that enroll people in health insurance, help them understand insurance plans, understand their benefits, and we also have mental health care navigators who connect people to services and resources that they need for their wellness and their well-being. Health insurance, as we all know, ensures that a family has access to the care that they need when they need it. This includes preventative care and, like I said, access to those mental health care services. Since the start of the pandemic, our FERC Health Navigators have helped over 800 individuals in this community enroll in health insurance. Our mental health navigators have helped 500 families access different resources and services to take care of their mental health needs. We know that pre-pandemic, our community really suffered and struggled with mental health issues. The pandemic has only made that harder, and that's why it is so important to have affordable health care plans so that people can access the care that they need. What some folks don't know is that the Affordable Care Act plans offer $0 copays to go see mental health care professionals. So again, it's making all those connections so that our families have the access to mental health care services that they need. And that's just one component of these ACA plans. It's critical for the stability of our families, for our communities. As we all know, strong families make this a strong community. And so that's why we are so excited to be a part of this day, part of this announcement with Governor Polis and our representatives here. So thank you so much. And just a quick reminder, I know Governor Polis mentioned this, but health insurance enrollment starts November 1st. If you all know anyone that is struggling, that needs help, that doesn't understand what type of a plan fits their budget and their needs, come see us at FERC. We're here to help, and we will be here to help and keep our community strong. So thank you so much. I'd like to introduce CB, the Executive Director of Team Summit, to share a little bit about his experience with healthcare with all of us. Thank you.
Thank you. Thank you, Governor Polis, Peak Health Alliance, and the FERC. The changes to healthcare insurance, particularly reinsurance, and what it's done to stabilize lower insurance premiums has impacted me personally, and it's also impacted me as the executive director of a nonprofit business. Personally, I lived in Colorado for 10 years before I was employed by a business that offered health insurance benefit. That meant that I was on my own to purchase insurance for me and my family, and since the cost of insuring a family was higher than the cost of my mortgage, I was forced into some really difficult choices. So during much of that time, I prioritized my kids and had insurance for them, but to save money, I didn't have insurance for myself. So as you can imagine, that left me one accident from financial ruin. That was a difficult choice to make, but at the time it was necessary to make sure the kids were insured and that all the other bills could be paid. As the director of a nonprofit seasonal business, one of the greatest challenges is employee retention, or employee retention, has always been competing with larger companies in providing health insurance benefits for employees. Small group insurance premiums are some of, if not the highest premiums. But as an employer who cares about our employees, we want to be able to provide them with health insurance to ensure that they have a good quality of life. Last year, I had a conversation with the Peak Health Alliance about our options. They introduced us, me, to an ICHRA, which is an individual coverage health reimbursement arrangement. And through that, and thanks to reinsurance and lower rates through Peak Health Alliance, our organization has been able to provide all of our full-time year-round and seasonal employees with health insurance at a reasonable cost. This improves the employees' quality of life. It allows them to see working for us as a long-term opportunity, and in the end, that allows us to have and maintain a higher quality and more experienced staff. Through reinsurance, through Peak Health Alliance, and managing the cost of premiums, not only do we gain better staff, but allows us to control the costs to our membership because we don't have to pass along those higher employee insurance premium costs through the fees for our organization. So thanks again to Peak Health Alliance, to FERC, Governor Polis, and countless of others who understand the value of a healthy Colorado and have taken measures to ensure expanded access to quality healthcare coverage in our state.
Thank you. We'll be happy to take any questions. Okay, well, thank you all. This is, again, part of a comprehensive agenda to save people money on healthcare. And in addition to the work with PDAB, the Colorado Option, integrated behavioral health with physical health for better outcomes, reinsurance is a key linchpin of making healthcare more affordable for individuals who don't have employer-based healthcare coverage across our state and especially in the high country. Thanks for joining us. Let's close with this, with our reactions here. Our representatives, okay? Dan, come a little closer. There we go.